before I go into what will be a very brief flash through the year, I should reiterate Edward's comments about the commitment and the continued purpose of you as a workforce and of all our stakeholders in staying on track through what are, after all, quite difficult times in terms of the policy changes and other distractions we've got at the moment. So, yeah, that's a well done from me as well, and thank you. So, let's begin and look, as we've done in each of our 10, this will be the 10th of our AGM since we formed as a PCT, by looking back at how we've done. And I hope you'll enjoy this because there's some good, as always, as in every year we've gone forward as an organisation, you'll see some really good news for our population. So what's the context, first of all? Well, briefly, I don't want to dwell on this for too long tonight, but this is the big change agenda we're facing at the moment. The coalition government's policy for reforming the NHS, called Equity and Excellence, Liberating the NHS, is gaining momentum. It's working its way as a bill through Parliament at the moment, and the likelihood is that it will be through before the end of this calendar year. We know that signals the end of the PCT as an entity, if you like, in the NHS. So we're busy getting on with designing the new architecture with the GPs in the forefront as commissioners. We're also clear in doing that public health is taking a renewed emphasis and embedding in the local authority. And I think many of us have seen for years that there's an anomaly between, separating public health NHS from public health, the main sort of contributors to people's health, which generally sit around the economic environment, sit around all of the sort of features of people's everyday life, housing, and education, employment, etc. So it was always logical to take that step, and I think we can make it successfully in Salford. All of this set against the context of difficult economic times, and here in the news driving over tonight, they certainly haven't got any better today, and the economy's in some woe, which directly impacts on our capacity and our spending funds for the population. So we've got to be even better and sharper at getting value for money as we move forward. What were we up to in 2010-11? Well, there's a number of key things associated with that change in policy. The first was, and I think we got through this probably with less turbulence than anywhere else in Greater Manchester. We transformed our community services, which are largely now managed by Salford Royal Foundation Trust. The reason I'm stressing our success there is I think we've done a really good job in embedding that service into Salford Royal Foundation Trust. They're working very hard on making sure that the service talks to their acute hospital services in a coherent way. And in particular to stress that having done that, there are still some of our colleagues in other parts of Greater Manchester who haven't finished this work yet, and I think we've got our community staff to a safe haven and are able to get on with providing care rather than worrying about their futures. Hundreds Health, you heard Edward Vitalis comment about Hundreds Health Salford. That's the emerging GP commissioning consortium, and we're really proud of the work our GPs have done with us in Salford over this last 5 years. So we're in a position where we weren't wrong-footed by national policy, telling us that GPs were going to lead commissioning. We've been on a journey to do that in Salford for 5 years, and I'm really pleased to say where we've got to. More to do, but we're making really good progress. NHS Manchester is the embodiment as a board of all 10 of the Greater Manchester PCTs. So you heard Edward describe us as a locality now. And we're part of the board, which I'm very proud to say is led by Professor Alan Campbell as chairman, Dr. Mike Burrows as chief executive, and Mrs. Claire Yarwood as director of finance. Is anybody picking up the theme there? So great news for not just for Salford, but I think for the rest of the Greater Manchester economy. That's where the leadership comes from. And back down on the ground in Salford, we're busy making sure that our locality management, that we keep on track in Salford in the locality PCT and keep our eyes on our priorities rather than on all the sort of disturbances and the policy changes. So about achievements, I just want to say a few things because as always when we stand here, and you'll be familiar, it's normally Mike Burrows who would do this bit. We can point to a whole array of achievements. we finished off a process under the previous government administration called World Class Commissioning, which some of us made great, got great benefit from in terms of improving our systems and processes. I think at the last AGM, Mike was able to announce, even though it wasn't formal then, that Salford had been ranked the second highest of 151 PCTs in England in that assessment process. And whichever government's in power, that's an impressive achievement, I hope you'd agree. Something rather, perhaps a bit more so, but our use of resources assessment is level 3. That's the highest assessment that any PCT achieved, and we're with a group of PCTs who met that level. We've always been in that position, and that's part of the legacy we intend to leave for our GP commissioners in the future, and indeed for public health investment in the City Council. We attract, if you like, luminary visitors, and we had Paul Burstow and a chap called Andrew Lansley came to see what we were doing back in the end of last year. Particularly impressed with the work we've done around carers in Salford, and the fact that we were, I think, cited as an example of best practice nationally in that field, but in other areas as well. We've achieved conference recognition about our primary care information management, around the cardiac rehab team, and I think every year when we have this AGM, I can't think of a year when the cardiac rehab team hasn't successfully achieved some award or met some standards. So again, that's one of our strongest services. And then you'll see Mike Rose's name there, because Mike was nominated and successful as the NHS Leader of the Year for this time last year, and we were hugely proud of that. And Mike, with his usual humility, was extremely coy about sort of standing up to accept such an award. But all of us in the room knew how hard he'd worked to deserve that. So that was great for Salford and great for Mike. The Michelle Young Award for Down syndrome screening, again, successful awards when we're compared with other parts of the system, which is always, awards are everything, but it's really nice when we get cited and we're compared with our peers and other authorities to see how we do. So again, that's great news. Sorry, I jumped to that one, which is the Joe's Trust Award. I should have said that as well. This is about extending screening to women who wouldn't normally find it easy to access NHS screening programmes for cytology. So again, we won an award for that. So really, really proud of all of you who contribute to those things. Some other things, and those of you who know me very well will know how uneasy I am with that particular crest on the side of the bus, but I'll follow my loyalty to the other side of Manchester and say it was great that Manchester United and Aviva Bus Company supported us in the launch of our health bus, which, if any of you were in Salford Green outside the City Council a couple of weeks ago, it was out there doing roaring trade with Janice and other people pulling the public in to do free health checks. And wonderful that we can get things like that off the ground and keep them in Salford. We recently saw our 1 millionth patient through the gateway centres, and for people like myself, Brian and I, people who've been here right since the outset of the PCT, these were just a germ of an idea in our heads when we began, and to see 1 million patients go through the door, and what a fantastic testimony to all the hard work we've all put into this. You've all made contributions in some way to making these gateway centres improve the standard and accessibility of healthcare in Salford. Various campaigns, we get the right treatment at the right time. I don't want to dwell on these too much because there's lots of them, and as always. There's a Change for Life convenience stores where we make fruit and vegetables accessible at a very affordable price in various stores. Intriguingly, that one was in an off licence, and those of you might recognise that's the lead member for health in the council. I'd like to suggest he's there for the vegetables. So, there we are. We ran the End of Life Week promoting support for end-of-life care pathways early in the year, which again achieved great interest from the local community and various stakeholders. So again, all these things have helped to keep Salford's health agenda bubbling and vibrant and keep the public interested. The Goodman Health Centre opened in the Latsburn clinic last year and has provided a bespoke service for access for mental health, for sexual Again, from where we came from on that, we were subject to a national review as being a poor performer around access to sexual health services 5 years ago. We're now right at the top of the national standards for access, and there's testimony through the people there who worked really hard on that, and some of you are in the room tonight. So what does that leave us? And what we've got to do, we've got, by all accounts, another full year after this year to complete as a locality PCT before the new order is cemented, really. And this slide is saying, well, most of all, we ought to make sure we leave a robust legacy for our successors, so that the City Council and 100 South Salford, they may or may not be called that in the future. I don't know what the government's going to demand of clinical commissioning groups, but so you've got a stable platform with stable finances, clear plans, and a clear understanding of the population's needs to move forward. So we want to make sure through this period we maintain stability, and we've done that so far. Things are moving a lot in the NHS at the moment, but I'm standing tonight suggesting that we've kept Salford, and you in the room could testify to this, a relatively stable place. We've not seen mass losses of staff, etc. Support consulting development and support our staff through this, and I'm really keen, and I see it as probably my primary task now as a locality managing director, to do the most to make sure we ensure the transition of you as individuals into the new world, as much as the national policy allows that, whilst keeping our performance going. So we also want to retain our corporate memory, because I'm really proud of the last 10 years, and I know where we came from, and I know what we've done over that period, and that'll become part of the, if you like, the bottled up history in the future organisations, and I want to make sure that it's built on and we don't lose the things we've done over that period. And the bottom line on all of this is keep delivering services, keep improving health and improving access to health, because unless you're doing that, then the rest of it's not that important. So last thing about that slide is, if anybody's spotted it, that's exactly the same slide Mike Burrows put up last year, because we think it says exactly what we need to do. And, as always, Mike got those things right. So